This is the 4th year that we are actually presenting this Elegant Fan Award. And we are presenting this to a person who has demonstrated exceptional skill and unusual enthusiasm in pursuit of either a cure for lung cancer or a noteworthy increase in public awareness of this disease. This year, we are very proud to present our 2012 Fan Award to Dr. Yolonda Colson. One of the few women in the world who are cardiothoracic surgeons. She is also the director of the Women's Lung Cancer Program at Brigham and Women's Hospital and Dana-Farber. She has received countless awards for her research, grants, and patents for innovations in drug delivery systems. She has shown exceptional leadership in women's health, including founding the Women's Lung Cancer Forum. As her colleague, Dr. Francine Jacobson says, Yolonda empowers women to fight lung cancer. Ladies and gentlemen, please join me in saluting Dr. Yolonda Colson.
Such an honor, and I have known Hilda for a long time, and I've known some very great women and men, obviously, that have lung cancer. And I don't have great words to explain how it all started and the passion that I feel. But I think there's a couple things, and I think one of the things before I get too far into it that I want to make sure is I want to really thank Upstage Lung Cancer, and I want to thank Hilda and Joyce and all these performers. Because if you've ever tried to put together an event like this and a fundraising like this, you have no idea the amount of work it takes. And I really want to give them a congratulations. I wanted to take, she asked me to say a short talk about some things, and I think there's some real thanks to all of you to help with this that I think is really important to understand what a difference you're making just by being here tonight. And I want you to get a window on what I see and how this kind of all came about. So if you can imagine for a second, what if you were a 56-year-old woman who had 2 children and had a cold that just didn't go away, or you had a chest x-ray for some other reason, and you end up with the CAT scan, you found out that you get a biopsy and you're told that it's a cancer. That this spot in your lung is lung cancer. And the reality is, that is the reality for about 110,000 men every year and 100,000 women in the US alone. It's the second most common solid organ cancer in women, second only to breast cancer. So what if your doctor told you, now that you know that it's a major health problem for women, and that lung cancer is the greater threat to your survival than breast cancer, which gets all the publicity? That more women actually will die of lung cancer every year than breast, ovarian, and uterine cancer combined, but it's hidden because nobody thinks about it and nobody talks about it. And that's what these groups like Upstage Lung Cancer do. We shine a big light so we can see that it's really important. And what if everyone says, oh, but they're smokers? The reality is you never smoked. Or quit 10 years ago, because that's who the patients are. 25% of women never smoked. They don't deserve any of the discussion. And the vast majority of patients quit a long time ago. It's just a block. And we need to take down those blocks and really make a difference to all these patients, because they matter. So what if organizations like Upstage Lung Cancer can change the world? So close your eyes for a second. What if we can create places where patients with lung cancer can be treated with understanding and compassion, they can get hope, where all these issues that are unique to women, and how can you navigate getting treated, getting all this stuff done, and we can understand what it takes to hold your family together and get through a critical illness? What if we can kind of look at everybody with the whole goal, we're going to cure you through targeted therapies or whatever? Can we do that? And the good news is that we're starting to do that. We now know that women have different risks and susceptibilities to get lung cancer. They get different subtypes of lung cancer. They're more likely to have all these different gene mutations that we are now targeting. That they have better survival and better responses to many of the therapies. They have different perceptions to pain that we can treat differently. There's different societal roles. They'll interpret their choices differently, and they need different support systems to cope with critical illness. And we're now targeting all those different things to make a difference. But we also want to find out why it is that women have these differences. So we're changing the way we look at it. We're looking at the Women's Lung Cancer Program, not to say we don't think that men are important, but because we know we need to choose the right treatment for the right people. We also want to build a community of people that can talk about this disease, because we don't have it. We really want to have fellow warriors and friends, and that's what this group is. And that's what this is a celebration about. Because people don't talk about it. They don't want to say anything. And that's what's so great about tonight. Because it really makes a difference. We dream about ways of screening. We dream about ways of being able to diagnose with urine tests, like pregnancy tests. We could start screening for it. We could find it. So there's clinical trials that are now looking at that. We're looking at ways of preventing lung cancer after you have surgery. Looking at drug-eluting polymer films that go in at the time of surgery. And we dream of finding a way to find hidden cancers in lymph nodes before they grow. So we're looking at near-infrared imaging, ways to find where the cancer cells went. And we dream of ways of looking at chemotherapy directly at the sites where the cancer cells go, so that we can get nanoparticle drug delivery systems to follow. All these things aren't news anymore. They're all things that we're actively doing that are going to change the difference. So in an economic time when hope seems a little difficult and we don't see how we'll have any way to make a difference, and it's hard to imagine what if, groups like Upstage Lung Cancer keep the dreams alive. And with all the funding, I'm amazed at what Hildy's been able to do, make a real difference. So we want to do more than just maintain the status quo. We want to change the world so that every patient diagnosed with lung cancer gets out of that there's no hope to there's lots of hope. There's a community to help them, and we can make that difference. If we can screen for lung cancer and find a way to catch it before it's gone anywhere, that'll triple the survival for lung cancer. If we can find a way to prevent lung cancers from coming back, together with finding it early, it would completely change lung cancer to a curable disease. That's not that hard to imagine we could do that. And I think that's what this is all about tonight, because we know we can. And I want to thank all for your generosity.